My name is Elizabeth McKissick, and I'm a co-founder here at U-Turn. And I've got today my sidekick, Shay Hauser,
Good to see you guys. Glad to be here.
and he too is a co-founder of U-Turn. And today we would like to talk to Dr. Shamini Jain and all about what she's got going on her mindfulness journey platform. I'll let her tell you about it rather than read her bio. It's very, very impressive. So with
It's
that, I'll turn
definitely more impressive than mine. I know that.
Yes, for sure. So with that, I'm going to turn it over to you to tell us about yourself and what you have going on with your nonprofit.
Well, thanks, Elizabeth. Thanks, Shay. It's a pleasure to be here. My name is Dr. Shamini Jain, and I come to this from a mental health perspective. I'm a clinical psychologist, and I've been privileged to learn in some of the best universities. And we've learned a lot about how the mind and body can help heal itself. I've done my research in an area called psychoneuroimmunology. They say if you can say that word about 5 times really fast, you get your degree.
Okay, that's good.
What it is. It's just a way of exploring this wonderful connection that we have between our brains and our central nervous system and our immune system and our hormone system, and what role our emotions and our thoughts and even our energy play in our healing process. So I've been studying this. I've done my own randomized controlled trials in healing, in meditation, energy healing for some time. And I started a nonprofit, which is called the Consciousness and Healing Initiative. And we're a collaborative that brings together scientists, practitioners, educators, and even artists to help lead humanity to heal ourselves. I've been really privileged to learn from a lot of these folks about how deep the data is behind our ability to heal ourselves and how that plays a role in things like addiction.
Wonderful. Wow. That's a mouthful. All right. So, when did, let's see, how long have you been doing the Chai collaborative? What do you want to call it? The Chai Institute? The
We
Chai?
actually call it Chi for short.
Chi.
So
Okay,
Consciousness
there you
and Healing
go.
Initiative, or
Ah,
Chi,
okay.
and which is kind of a play on words because a
Yeah.
lot of what we study is what we call the biofield.
Okay.
And the biofield is this new term that scientists have been using in the Western world for about 10, maybe more years, that describe the fields of energy and information that guide our healing.
Okay.
So it's really the fields of energy and information that connect us and heal us. And so we're talking about things like bioelectromagnetic signals that come out of our body. Now, that might sound kind of far out, but it's not, because we use those to measure our heart waves. We go to the doctor, we get an EKG. That's part of the biofield. We measure our brain waves. That's part of the biofield. We can look at the electrical changes in cells. That's part of the biofield. And we can actually manipulate the electricity in cells to grow new neural tissue. So this is just, some really interesting, great science that's coming out with the biofield. But there's this whole other aspect to it too, which plays a role in how we understand meditation, yoga, and even prayer, which is more of the subtle aspects of energy that people have talked about and worked with for millennia. And those really seem to play a huge role in our healing process at all. We've done studies looking at things like laying on of hands for reducing fatigue in breast cancer survivors and seen effects not only on reducing their fatigue, but in improving their hormone levels.
Wow.
We have studies actually that are being conducted by our colleagues at MD Anderson Cancer Center that are showing how energy healing can reduce tumors in mice models of cancer.
Wow.
It's amazing. And what it's teaching us is how powerful our energy is for
Yeah.
healing ourselves and others.
Okay, well, so right now we're coming at the end, we hope, of a pandemic, right? Everyone has been so stressed out. Mental health is being talked about, thank goodness, more than ever right now. It's a hot topic. We hope that when the pandemic ends, that it doesn't get pushed away. We hope to reduce the stigma around getting help for mental health. Getting help for, U-Turn focuses on substance use disorder, but what we've learned from experience and from research is that mental health and substance use disorder go hand in hand. And if you could speak to how, I personally suffer from depression and anxiety, and I would love to know ways that I'm looking into it. I have looked into energy work, ways to heal my body without taking a pill. For years, that's all we've been told is if you have a problem, take this pill, take that pill, if you're anxious, So if you could speak to us a little bit about maybe some recommendations, maybe for mindfulness or some of the cool things y'all are doing in healing your body, because I think there are a lot of listeners out there who are very depressed and very anxious right now with the pandemic. And, the whole world right now, I feel like is just, we're all very stressed. And one of the main reasons I wanted to have you on today was to give us some tips and helpfulness and maybe tell us how your group can help us going forward and how we can access like your meditations that you do that I know. I've done one on Insight Timer, and it's wonderful. So if you could just kind of talk to us about how we can begin to help ourselves without taking pills
You
necessarily.
bet. You bet. And I should mention that I have a book coming out in September that's actually already available on pre-order on Amazon and other places. And it's
Wonderful.
Healing Ourselves, Biofield Science and the Future of Health. It's going to be released by Sounds True Publications at
Awesome.
Macmillan in September, but people can pre-order it now. And the third
Pre-order
part of
on
that
Amazon now. Thank you.
Yes.
that book is developed into a couple of parts. One is to describe the science behind what we know about healing, and we cover things like placebo, mind body practices, and this biofield work. But a large part of that book is what I call the healing keys, where I've kind of distilled and integrated some of the best practices from clinical psychology as well as spiritual practices and the science of what we know for these steps that we can take to help foster healing in ourselves. And I'll just share a couple of them with you now. So one is what we call grounding. Okay, so this is a little bit new for some folks that, have not heard of grounding before. It's used in different ways in the psychology fields and in other fields, but when we talk about it from an energy healing perspective, we're literally talking about connecting our bodies bioelectromagnetically to the earth. And believe it or not, there is data behind this. There are lots of studies showing using grounding mats where we electrically connect ourselves to the earth that we can reduce inflammation, we can improve our immunity, we can change our cortisol rhythms, we can reduce stress and improve sleep and reduce anxiety. So that's real data that's out there. And I review all of this and much more in my book. But there's some practices that people across the world have been doing for thousands of years to connect with the earth.
Okay.
And a lot of us have this felt sense of it, right? So in Japan, there are all these studies doing a practice that they call shirin-yoku, which is basically forest bathing. Okay. So what
Okay.
is this?
Yeah.
This is actually just getting out into nature. Nature heals. And what we know is that trees connect with each other, they communicate. Mushrooms, for example, there's a whole bunch of research looking at how mushrooms communicate underground. Well, guess what? We connect with them too.
Mm-hmm.
So all we have to do is basically allow ourselves to bring awareness to our bodies. So this is where the mindfulness piece comes in, right? We follow our breath. And some of my meditations that you mentioned, we do this. We follow our breath all the way in our bodies. And I just want y'all to do this, maybe our listeners, and you too, Elizabeth and Shay, if you'd like,
Yeah.
just take a moment and notice your breath, first of all, coming in and out of the body through your nose. And know that there's no right way to do this or wrong way. You're just going to follow the breath coming in and out of the nose. And see what happens if you just allow that breath to travel down the body, down the legs, and see if you can note any sensations in your feet, your toes, the soles of your feet, your heels, and just allow it yourself to sort of sink in. Just let the breath kind of guide you down your body. And as you're breathing naturally, allowing the sinking in your seat, sinking into your legs and your lower body, your feet, connecting with the earth. Feel as though you have roots that are coming down through your feet into the earth. So you're really feeling that connection with the earth. It's almost like you're breathing into her, just letting everything release down into the earth. the flow of ions just flowing down into the earth. And then you might notice that the earth flows into you as well. And you can allow yourself to feel this by feeling that almost like a gentle push of energy that comes through the soles of the feet and up the legs, up the calves, to the knees, allowing that energy now to flow through up the thighs and the tailbone, the hips, the lower abdomen, the stomach, the bladder, the belly button, the lower back, and then allowing that earth energy to travel upward, up the back, up to the heart and lungs. You can feel that breath really freeing up the area. Just allowing your breath to enjoy this energy traveling up the body, up through the shoulders, the neck and the throat, up now through the face, the lips, cheeks, the eyes, the ears, back of the head, forehead, all the way up to the top of the head. And just letting that energy release out the top of the head, and almost like a shower of light coming back down the body. And just enjoy this connection for a moment. And then bringing your awareness back to your heart, giving thanks for this practice and your connection with a greater being that is the earth and all of us who are part of it. And then when we're ready, we can open our eyes.
Wow.
That was awesome. I could feel it in my feet.
I could too.
When you said that about the heels, I felt like this, I don't know if it was tingling or I just felt something.
I felt
It was
heavy
really
down
cool.
there. But then the thing that I felt the most was the light coming out of my head, like a shower. And I felt all tingly all over. So you got us.
Yeah.
you won us
and I
over.
just shared that this is not, this is still not 100% mainstream. A lot of the work that we do at the Consciousness and Healing Initiative is helping people understand that there's real science behind these practices that are time-honored traditions. So a lot of people think of energy healing and that kind of stuff as really woo-woo, but we don't appreciate that we are bioelectromagnetic beings. So we have this connection with the earth and with each other. We just haven't really been tuned to putting our awareness there. But the data shows that when we do, and this ties back to mindfulness, you can think of this as subtle awareness.
Yeah.
If you don't want to think about energy healing or that feels kind of woo to you, think about it as subtle awareness. You're just getting more in tune with your body, and your body is a natural healer. So the more we kind of get out of just being in our heads,
Yeah.
and kind of on screen and our mind kind of like running our lives. There's this great saying by Stephen Hayes, who's a founder of acceptance and commitment therapy. Y'all might know about that therapy. And he has a book called Get Out of Your Mind and Into Your Life. Well, the way to get out of your mind and into your life is to get in your body. So, that's step one for healing ourselves, is to reconnect with our bodies and that greater wisdom that surrounds us. So whether we call that God, our soul, spirit, whatever. And, I know, for example, Shay, we were talking about 12-step, and, there's a lot of great focuses in 12-step, especially in my view, the focus on surrender, which is part of what I describe in the healing keys. And, even from a mindfulness perspective, or if you look at other comparative traditions, surrender is really about allowing ourselves to merge with a greater consciousness than our conditioned mind, right?
I like that.
So when we talk about surrendering to a higher power, we're talking about surrendering beyond our egos, beyond our cravings, beyond our likes and dislikes, into something larger. And that's what we're all being called to do right now. So to me, it's no surprise that, yes, we absolutely have a mental health epidemic. And I think what we're going to realize is that the tools that we're going to be using that are beyond just medications, as you say, they're opening us up to this greater consciousness where we're all connected. So as we begin to heal ourselves, we're also healing each other, because emotions are contagious, right?
Sure,
We know that. We
absolutely.
figured that out during the pandemic, if it
Oh,
wasn't
yeah.
clear.
Yeah, yeah.
But they work the other way, because the data is actually suggesting that our own happiness spreads across networks.
Yeah.
Isn't that cool?
There's actually, not to bore you guys, but there is actually data suggesting that if you are happy, this is network data that's done over, thousands and thousands of people. They discovered that if you're happy, there's a 42% chance that your friend a half mile away from you is going to be happier as well
That's
6 months later.
crazy.
So they can predict these things.
Oh my God, love it.
Yeah. And I mean, we have to figure out the how and why, and like, how does that work? There are a lot of pieces to that, in terms of how it works, but it works. Okay. Our emotions are contagious. Our energy matters.
Wow.
I was listening. So I was listening to one of your previous. I don't think it was a TEDx talk, but it was a previous talk that you did with somebody, and something you said or you were talking about that just shocked me was the placebo effect.
Mhm.
And like I think I always just fundamentally understood, yeah, there is some placebo, but I was shocked by the percentage that you were using related to just various medications and then placebo type surgeries. I couldn't believe that.
Yeah, so that is in my TEDx talk. I think I did talk about placebo in that particular talk, and I unpack placebo heavily
Hmm.
in my book, because I say that, we've misunderstood what placebo is. Even in science, we have this idea that we have to get rid of the placebo effect, which is completely backwards. Placebo is telling us about our ability to heal
Yeah.
ourselves. So we always think it's the medicine, whether it's a drug or an herb or exercise or whatever. But that's just one small part of the picture.
Right.
What placebo research is telling us is, again, how we can heal ourselves using very specific steps. And I go over this in my book, but, what are the things we know from placebo that we can use today to help us with our mental health and our physical health? Expectation is number one. That's our mindset. That's our kind of our conscious mindset, how we view the world. When I go to take that COVID vaccine, or I go to take this medicine, or I go to take this herb, or I go to a meditation class, what do I expect is going to happen,
Okay.
right? Do I expect that I'm going to get better? Our expectations drive our healing tremendously. There's so much data on that.
Interesting.
There's also data on what we call conditioning, which you can kind of describe as the subconscious patterning within us. So consider this. If you've ever gotten a massage and it was relaxing, and then you go to get another massage, when you lay on that table, your mind body is already conditioned to be like,
Yeah.
before
Yeah.
you even get touched. Conditioning. So that's conditioning. It's powerful. And we can use that by saying, where do I feel at ease? In what situations do I feel at ease? Where does my nervous system relax? If I relaxed before, I'm probably going to relax again. So, that's where when we develop a habit, that conditioning really works for us. When we develop healthy health habits, our body knows to respond in the same way. There's also what we call ritual. Ritual is everywhere. We engage in rituals all the time. We just may not be conscious of it. So we can consciously create healing rituals, which can be as simple as, things that we might already do, like in the evening, having a cup of herbal tea and winding down the nervous system, closing the computer, doing what we did, a grounding practice, things like that. Creating a healing ritual can be really important for our health. There's data to support that. And relationship, which means our relationship with our providers, our ability to communicate. How much do we feel like the people that we're interacting with are there to help us in our healing journey? The more, for example, that doctors are friendly, and this is proven science, as well, looking at effects on immunity and all kinds of things, the more your doctor or your healthcare provider or your therapist holds that space of positivity for you in your healing process, the happier you're going to be, and the more you can actually augment your own. So these are just some of the things that placebo tells us. It's really, really powerful.
Yeah, the ritual aspect, I just think about my own life, just the ritual I have in the morning and the consistency that I do that has become so important. In other words, I notice like if I travel or if for whatever reason, if I stay up late and I don't get up early and I don't use the same ritual, the same patterns, I simply don't feel as good that day. It's become such an important part of everything that I do. And I guess to some degree too, I was thinking about like I go to acupuncture every couple of weeks for neck pain, but it's like I'll swear by it now. When I first went, I was like, I don't know, I don't know, I don't know. After I was drooling on myself after the third time, and my neck was good driving home, I'm like, I'm in. So and I don't know if that's a mix of like the mindset and the belief and the idea of self-care and self-nurturing
It's
along
all of
with
that.
it's
Yeah,
kind of
and your
all of
nervous
that
system.
combined, right?
It's your nervous system too. I mean, there's a real physiology to this. So let's take the example of you going to your acupuncturist.
Mm.
You go in, this is new, it's novel. Usually when we encounter things that are new and novel and we're hoping to get healed, there might be some anxiety to that,
Uh-huh.
right? And nobody likes to get stuck with needles. Let's just be
Right.
honest. Most people, the first time they go to an acupuncturist, they're kind of wondering how that's going to feel. But your acupuncturist is likely very skilled at calming down your nervous system.
Hmm.
And a lot of these integrative healing practices, the way they work is to stimulate your parasympathetic nervous system, which is your rest and digest system. So that allows the body to calm itself. You go a couple of times and your body's already learning that, oh, when I go here, I feel good. My body starts relaxing to the point where I'm drooling on the table. I'm
Yeah.
so relaxed, right? You're making that a ritual, so you're packaging all that
Yeah.
together to allow your body to do what it does best, which is heal yourself, right? And your mind is now not in the way because you're not as nervous anymore
Yeah.
about what it is. You know what it is. You've experienced it and you've made it a habit. So it's a great, I love that example. Thank you so much, because you've just shown how all these things can work together, and ritual is a huge part of it. And if I may, because I know that there's a spiritual component a lot of times for people when we're going through recovery.
Hmm. Absolutely.
Rituals, in native traditions and traditions all over the world, were also a way to opening up to greater consciousness or spirit, right? So whether you think about that in terms of healing rituals that native elders have done in many, many different cultures, it's a way of quietening our minds and our bodies and opening to that spiritual assistance, right? So whether we do that through devotional prayer or meditation, or just simple quietness and listening, it allows us to open up to spiritual guidance. And
Hmm.
that's super, super helpful for healing.
Yeah, I mean, I think that's for me. I know that's crucial too. To get my, just to get the like my adrenal system right and to be
Hmm.
able to calm down. The spiritual aspect is crucial. It's just another part of all of these things I have to do to keep myself in like good, stable shape. I think that, I mean, to a lot of extent, I guess I believe that if I can maintain peace and calm, then the likelihood of craving and mood altering is diminished, right?
Hmm.
If I'm in a good spot, I don't need to use, I don't need to eat 6 chocolate donuts, I don't need to drink a bottle of wine to numb. But something I've noticed, maybe it's part of COVID, I don't really know, but something I've noticed lately is the anxiety and the stress that's been sneaking up on me recently is it's coming in subtly. And what I mean by that is it's taking me more time to like consciously recognize events that are going to cause stress in my life. And it's like
Hmm.
I'm minimizing them and I'm like, oh, I got it, I got it, I got it handled. It's not a big deal.
Yeah.
And as I'm going through it that week, it's like, look, it's all good. And then all of a sudden, I'm just like I'm mood altering. I'm not there. I'm just not in a good headspace, and I've got to unwind all of that thinking and behavior and go back to the basics. Breathe, like breathe, pray, chill out, all that. But it's
Honor yourself. Yeah.
yeah,
And
just
honor
trying to
setting boundaries, right? This
yeah.
is really huge, because thank you for naming that, because in this time and space, especially for those who are called to serve, like you guys are serving, right? It's really easy to say, okay, I got it. There's work to be done. I've got all this to get done. I have people counting on me. Like there's a lot of that we can carry as people who are servant leaders. And we also are wise to remember that we have to create that time and space for ourselves, right? So this is where it goes right back to self-care and knowing that we're not stuffing our emotions, that we do create these times and spaces to unwind, unpack the day, because, from an energy point of view, there's a lot of energy flow happening. And we pick up emotions and energy from others, and that's not something we have to be afraid of. We just have to allow for time and space for things to flow through us so that we're not holding on to them.
Yeah, that makes great
That
sense.
self-care piece that you mentioned, and just literally allowing for a couple of hours or at least an hour a day that's just not scheduled.
I
You know,
absolutely do that now. I mean,
You have to.
all my previous businesses, I did what I was told I was supposed to do, which is work nonstop. So I
Yeah.
worked 7 days a week, and granted, Saturday morning it was only 3 hours. Sunday it might have been in the afternoon, but I never stopped working. And with U-Turn, I think we're so aware of the importance of like just emotional stability. I just don't do it anymore. I
We
don't
can't afford it,
Yeah.
frankly. I mean, everything would go under. If we don't take care, like put the oxygen mask on ourselves first, then nothing else works. I wanted to get your take too when we're talking about mental health. One of the things that keeps popping up are psychedelics and the use of psychedelics. And it's been done for centuries, and it's becoming legalized in a lot of different states, which I'm happy about because I think it helps. We help a lot of veterans, and it's helping them with PTSD, and it's helping trauma people come out of trauma, deal with that. What is your take on that? And does it correlate at all with what you guys are doing?
Yeah, thank you. It's a great question. We have discussions on this almost daily with our colleagues on, in different areas. In fact, my home institution, where I still serve as an assistant professor at UC San Diego, we just got the university just got a $1.3 million grant to look at psilocybin for
Awesome.
phantom limb pain. And as you know, there's a lot that's going on with anxiety for different patients. And of course, way back when, that was the agenda for psychedelics, was to look at this in the context of psychotherapy. So my view on that is, I think that psychedelics can be really powerful tools for helping unravel the conditioned mind to a greater sense of who we are as human beings and our connections with spirit, and helping us sort of get a little bit of perspective on what our habit patterns have been, how our conditioned mind has been driving us in particular ways that would potentially drive us to anxiety, addiction, things like that. The issue that I see in the way the psychedelic research is being done is that they're treating it very much like a drug. Okay, so they're really looking at it. First of all, they're looking at active ingredients that have come usually from whole herbs, and ceremonial use of plants that, are endemic in the native traditions,
Right.
particularly here, right, in the US. So we're sort of missing some of the ritualistic aspects of that practice and the deeper spiritual meanings behind them. And yet, the work that's being done with with psychotherapy combined with these psychedelics is good, because you still have that kind of trusted guide that's helping you navigate through some difficult memories, difficult experiences, to come out with a fresh perspective. Now the question is, what do you do after that? And I'm really excited to see how the psychedelic community kind of moves forward with, we can have these incredible experiences where we can show this change in a couple of weeks. Now, how is that change maintained? How do we integrate? Because we can have these incredible cosmic experiences of greater consciousness, right? And sometimes this can happen with meditation.
Yeah.
It happens just spontaneously. How do we integrate? There's a great saying called "after the ecstasy, the laundry," right? So it's
Been there.
that. So
Yeah.
I think the psychedelics continue to work with psychotherapy, with biofield healing practices. That kind of thing is sort of, we've been shown, what's possible, and now we kind of have to continue to do the work on our own,
Yeah.
right? It's not a panacea. Sometimes we want to think of these pills as like, all I got to do is take this pill and I'm done.
Yeah.
No, that's not it.
Yeah,
Yeah.
no, it's related to psilocybin. I think the integration piece is interesting because nobody really knows what that looks like yet. I think even in the professional field, there's still some maybe it's just a little unsure of how we do integrate that. And I've personally noticed a big difference between having a spiritual guide when I've done a macro dose and then doing it on my own in a spiritual manner, but without a guide. And I've gotten great experiences from both. The one with the guide was truly Native American driven, and it was beautiful and very different. But ultimately, it is about, for me, trying to like almost reset the operating system that I've been running under for decades that simply doesn't make sense. I mean, I tell myself these things because I've been saying it the same way for the last 50 years in my head. And being able to like try to break free from some of that and allow freedom to really explore like the practices you guys are talking about, that's what's important to me. I think it opens me up to truly believe and feel these new experiences can make a difference in my life. And I think
Yes.
that's what I'm real excited about, at least related to psilocybin and my own personal experience using it.
Yeah. It's great. Yeah, it opens us up to the possibilities of, our own energy, our spiritual connection, and then, we continue to excite ourselves and do the work that we want to do and explore practices that are going to nurture us and sustain our spiritual journey. And, to me, that's the most powerful thing that psychedelics can do is open us up to spiritual connection. And then we get to maintain that. We get to decide how we go about, engaging in our spiritual practice. But to me, that's really the core of it right there, the
Yeah.
spiritual practice, however you define that, right?
Yeah, I
That's
mean, I
yeah.
agree for
Mhm.
Liz and I both. I mean, that part's critical. I mean, it's interesting. We've got sort of different perspectives on like religion, if you will.
Mhm.
But at the end of the day, we're both like adamant that like a spiritual connection and practice is crucial. Like I have to have it. It may
If
be different than somebody else's. It doesn't really matter. It's
I,
just what I need.
yeah, and I think bottom line is the ego dissolving that and realizing that we're not the center of the universe, that there is something bigger, and
Yes.
whatever you believe that bigger thing is okay. It can be Mother Earth, it can be the galaxies, it can be the stars, but for me, it's God, and that is what keeps me grounded.
Yeah.
Is that practice of believing that I'm not the center. Um, I would love for you to be able to tell our listeners what your mission is going forward, and maybe some ways that they can continue to get more of you and learn more about what your organization is doing. And so, if you would tell us ways to do that, I know there's a newsletter to sign up
Oh,
for, but
yeah. No, happy to. And we want to invite everyone to join our community. We're a collaborative. We invite everybody to be part of the discussion and dialogue. So, as I mentioned, the Consciousness and Healing Initiative is a collaborative accelerator, we call it, to lead humanity to heal ourselves. And that includes all of us. So, we really believe that everyone has wisdom to bring to the table. And we do have community gatherings every month. We do webinars with trusted scientists and healing practitioners on healing, which are freely available to the public. You can go to webinarsonhealing.com and it will
Okay.
take you
okay,
to our webinars page. So, webinarsonhealing.com. And then every month we also do Ask Me Anything sessions with leaders in healing.
Oh, cool.
And often those are usually practitioners. We just did one last week actually with master musician Victor Wooten, who's a healer, himself, and really has a deep understanding of the spirit of music and the biofield and the work that he does. So that you can go to askabouthealing.com and that'll
okay,
take you to our AMA page. And in general, if you want to just connect with all of the wonderful things that we offer through the initiative, you just go to chi.is, and you'll see ways to jump and explore what we're doing with webinars, with our Ask Me Anything sessions. When you sign up on our email list, that's totally free. You can you'll be receiving really great nuggets, like you'll get announcements of the events that we're having, like these webinars and Ask Me Anything sessions, but also science, and some practices that our healing practitioners and leaders are sharing. For those who are interested in the research behind energy healing practices in this area that we call biofield science, our nonprofit has created a state of the art report and all these resources on this, that if you're a healing practitioner, holistic healing practitioner, or a doctor or whoever, and you just want to know, first of all, what do we know about the field? Like, what is even the market share? What kind of evidence is there behind it? Who's doing it? Where are we at with policy? This state of the art report and a really short 10-page executive summary will tell you everything you need to know, and it's freely available. You can share it with everyone. You just go to reportonhealing.com for that report. But you can access all of that through our website if you go to chi.is. I also do a lot of my own teaching. So I have my own website as well, which is just my first and last name, shaminijan.com. And I'm doing a lot of online work. I'll be leading an online course in healing starting in April. We have an awesome Science of Healing Summit in collaboration with our partners, the Shift Network, that's going to be airing in mid-March, which is going to be fantastic. And a lot of leading lights that y'all probably know are going to be there. Deepak Chopra, Bruce Lipton, Greg Braden, many other, Judith Orloff, like many, many different amazing people sharing their perspectives. So, we want to keep that dialogue going and share practices from different points of view. Everyone is getting to healing in their own way. There are so many nuances and facets to it. So there's a lot of room to play and engage, and we want to make sure that everyone does that. I'll also be teaching some in-person retreats at Esalen this year, which is out in Big Sur, California. It is a beautiful retreat center. Yeah, for anybody who wants to.
I was scheduled to go to Esalen this last fall, but I couldn't go because of the fires.
Yes. Actually, my program was canceled. I was going to be teaching there last fall, and so now
we'll
we're
take
going to.
a
I'm going
U-turn
to be
field trip for sure.
We're definitely doing Esalen. That's for sure.
Shamini, what if I know I'm local here, and you could help me out, but for our other listeners, if they want to get into some energy healing, how would they find a healer, a practitioner, energy practitioner? I mean,
That's a great question.
Are there websites or? Because I'm sold. That's how I want to be healed now. And I know there are other people who want to look into this, but how do you find someone legit?
Yeah, it's a great question. It's one of the problems we're actually trying to solve at the initiative too, because there are many, many different places to go. And there's also a lot that people probably want to know about. What's the difference between pranic healing and healing touch and sound healing and all of that? So, we're fundraising right now to get those resources to continue to share that with the community so they can see what the different jumping off points are. But just a few off the top of my head. Healing Touch is pretty well organized. They have a certification program. They have kind of levels that practitioners have to go through to get certificates, including amounts of hours that they practice.
Okay.
And they have a practitioner directory, so you can go to two places for that. Healing Beyond Borders and Healing Touch International are both organizations that convene and collect certified healing touch practitioners.
Great.
There's also a group that we work with that we've been doing research with. We didn't even have time to really talk about that, I don't think, but this is a group that uses sound healing. It's called Biofield Tuning, and they have a practitioner directory. So if you go to biofieldtuning.com, they have a list of people who have gone through the program, and demonstrated some capabilities to be able to do the sound healing work.
Wow.
So biofieldtuning.com has a list of practitioners. Reiki Alliance is kind of the group that holds all of the Reiki practitioners. There's pranic healing. There's a whole lot, and it's just helping people find those flows and explore. And I would suggest, a good place to start is to connect with us and explore our webinars, because we interview a lot of people from these different healing traditions, both healing touch, pranic healing. We just interviewed Donna Eden, who's a really well-known energy healing practitioner who has her own school. So it's a great way to just explore perspectives. One of the things that I tell people about when you're looking for a healing practitioner, because we're still working on standardization and certification across the board for healing practitioners, like that's happening, interview them a little bit and just ask them, have you worked with people who, have the kind of issue that I have that I'm trying to resolve? And, what have the outcomes been? And ask them if they would be willing to provide a referral of someone who's worked with them, and ask them, how their experiences has been. And then trust your gut. Okay. The body knows, the body doesn't lie. So when you meet a healing practitioner, if your body's going kind of like, ding, 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 I think this person can help me, try it out. If your body's kind of being like, oh, I don't know, listen to that. No matter what, they tell you about their expertise. If your body is telling you, I don't think I'm ready to work with this person, don't do it.
Yeah.
Okay.
That's great feedback. It's interesting. We're doing a lot of what we do at U-Turn ultimately is curate resources for individuals, because once an individual gets to the U-Turn platform, they're there for a reason. It's not just, hey, I'm bored, I'm going to go get on U-Turn. They're looking for education around substance abuse. And in many cases, it leads to additional questions. A lot of times it's a parent trying to, figure out what to do with their kid. My kid's in trouble, my kid's smoking weed, whatever it might be. And it may ultimately end up with like, what resources are available? Where do I send my child to treatment?
Yes.
We don't align with treatment centers. We're great with treatment centers. We love them. Liz and I both went to treatment. I've been a number of times. But at the end of the day, part of our responsibility is to curate resources. We know certain places are better for certain situations, right? If it's a 19-year-old female with opioids and sexual assault, there's a handful of places we're going to recommend. But ultimately, it's those type of resources at U-Turn. But then alternative therapies, exactly with what you're talking about, and energy healing is stuff that we're adding to the platform to just open people up to alternative ways. Because as much as we believe in the 12 steps and how important that is for sobriety, that only gets to a sliver of people. And there's a ton of people struggling. And it's not even alcoholism or addiction. It's they're just struggling. They're just having a really crappy week. They're drinking too much. They're placing too many bets. They're not sleeping. And they're just like level 9 anxiety, and they just need help. And there's just a lot of things that could go into that practice to help them take a deep breath, lower the stress level, and then just start knocking things out that add to the overall practice of self-care, mindfulness, and all these things that can heal them. And that's really the message we're trying to deliver.
And also get them before they get addicted, because I feel like so many people that I know personally started drinking because they were so anxious or depressed. And so they didn't have anything like what you're offering today. And had they had that, maybe they would have been able to do the mindfulness stuff, back off, because they would feel good and they wouldn't feel the need to numb.
Yeah.
So we feel like your practice, mindfulness, and all the different energy healings and all that can help people get out of the mess they're in before it becomes a true physical addiction.
I love that you name that. Elizabeth, one of the things that I say is when we're looking for well-being, the only place we need to look is the well of our being. Okay. So this is what you're talking about, because the more that we're fueled by the well of our being, that means, our own inner healing capacity, our ability to sense and feel harmony and restore ourselves back to that inner harmony, right? The less likely we are to seek out other ways to numb our pain, or seek pleasure through outside means, because it's actually truly all within us, right? Yeah. And so this is preventative medicine. That's exactly what this is. This is the way that we don't have to turn towards external things to guide our lives.
That's it. That's the message we're trying to get across now, as much as anything else, which is it's not even about U-Turn's not even about drugs and alcohol. That's the end result. That's an outcome of stress or trauma or anything. And let's really focus on getting each person to a place where they simply don't need that. If they don't need it, it's no longer an issue, right? So it opens up the door for some change for a lot of people that will never go to AA because they don't want to stop drinking. So for us, it's like, it's not even about quitting drinking. It's about getting yourself into a position to where you don't necessarily need as much or need it. That's massive progress. Like that's mind-blowing progress right there. If we don't do anything other than that, we've helped a lot of people.
Yeah, and it's just a way no one's ever looked at it before. It's always wait till the addict gets to the rock bottom and then send them to treatment. And then you don't do any integrative work. You don't do any mindfulness after that. You're just supposed to be well, right? Well, it's not the case. Yeah. You take away the Band-Aid, and then you're left with all this raw emotion with nothing to help. So
that's the issue with the pathogenic model. And I talk about this in my book a lot, right? This idea, the separatism, and that sort of that Band-Aid approach of let's wait till things are rock bottom and things have already manifested in the physicality and our behaviors, entrenched behaviors, and then we're going to try to work backwards versus, what you're saying is interrupt the pattern before it becomes a massive
bingo.
Pattern.
Yes.
Interrupt the pattern.
I know.
It's so easy. I mean, it's not easy, as you know, but it's, it is. If we start with our youth, like you're saying, and we start
Yeah,
before it becomes a problem, we can prevent all of this in the first
that's
place,
right.
whether we're talking chronic disease, mental health, addiction patterns, and I just want to name for anyone who's listening that, I mean, this, you probably know this already, but I just want to highlight, because there has been a lot of stigmatization of addiction. We're all addicted to something.
Sure.
We all are.
Thank you.
Absolutely.
Some things interfere in our lives more than others. Some things show up quicker than others. For those of us who are addicted to sugar, we may not see the ramifications of that 20 years later when we have diabetes,
Right.
right? But it's
That's
an
right.
addiction.
Yeah. Yeah. I
So,
mean, the way I think about it too is like I've had times in my life where I've been in a state of acute addiction. I mean, without question, I've been completely mentally unstable, probably walking around completely insane, and just out of my mind. That was a state of mind that led to just consuming as much drugs and alcohol as I could put in my body, simply. And hey, look, today it's in remission to some degree. It's being managed through a variety of resources that I use based on spiritual principles, but a whole lot of other stuff, and it's sitting in remission. It's there, but I don't, it's not driving my behaviors today, thank goodness. And for me, it's about managing that to where it remains in that state like any other disease that goes in remission. So I think it's a mindset. We're looking for different ways to talk about it at U-Turn and try to frame it up a little bit different to help people understand it's not black or white, this or that, addiction, no addiction, treatment, no treatment. There's a lot of gray. There's a lot of variables in terms of what's going on with somebody at any given time. So,
yeah, the body is dynamic. We are dynamic. We're ever changing. And, our research is showing that we really truly are bioelectromagnetic, which means we respond to our environments in profound ways. We respond to our own healing capacity in profound ways. So all we have to do is, well, it's kind of like you were saying, you change the filter, right? You're going to change your filter to kind of turn a little bit more inward. Our worlds have not like necessarily encouraged us to turn inward a lot, right? It's all
Yeah.
about outward achievement,
right,
outward this,
right.
outward that. But as we begin to kind of turn our gaze and our focus inward, and as we were talking about earlier in the hour, just realize that we're part of a greater whole, right? Then we can ignite that healing capacity in us. And then we
Like
don't
that.
turn to things that don't make sense for us.
Yes, I like that.
All right, I know your time is valuable, so we've got to let you go. But one more thing, you were talking about how we start with our youth. Do you guys have any way of working with college students, high school students? I have, all of the above, and this youth, they're more stressed than, I mean, it's so different from when we were there. I think it's technology, it's a lot of different things. But are you guys currently working on something for them, integrating that into colleges or high schools?
Thank you for that question. What I can say is that we're starting to witness a groundswell of people who want to do this now, and I think the openness is much greater than it ever has been. So
Good.
I'm aware of people that are working on curriculums to try to integrate this more into the education system. In the short term, what I would suggest for our youth, some of them are open to the energy stuff, and it's certainly like animes and all kinds of things are talking about chakras and energy,
Yeah.
and so they're kind of a little bit more tuned to it maybe than previous generations. But one thing that I recommend for everyone, kids and adults, we're talking about helpful, just everyday practices, turn toward creativity. So, kids are totally creative by nature, and then, sometimes they just aren't allowed those possibilities. But ways that we can help heal are really, there's a tremendous amount to say and explore about the creative response and, the nature of being creative as it helps to heal us. So there's an expression part of it where it's sort of like just expressing your emotions through art is helpful. And everyday creativity matters. So whether it's really just kind of, it helps you to sort of get out of your head again, your
Yeah.
anxious thoughts and things like that, focus on the moment and what you're kind of creating, whether it's like baking something even, or doing
Yeah.
something in the kitchen, or putting an outfit together, or just writing out, things that come to mind. I really encourage youth, especially, to take charge of their creativity. I'll give some just real world examples. My kids have been quarantined since March, as you know, Elizabeth.
Yes.
And one thing I've noticed that they just sort of did on their own is just engage in a lot of different creative acts. We didn't even have to guide them that much. And so, my daughter's painting clothes and she's making up dances and she's doing all these things. And it really gives her a deep sense of comfort and enjoyment and mastery, which can really be an antidote to all of the outward stress that's kind of being piled on our kids right now.
Yeah, interesting. That's great
Great.
feedback.
Yeah.
Good stuff.
Well, we're going to put, I've got in the show notes, I'm going to try to put all the links that you gave us in there for our listeners. And I mean, this has just been phenomenal. I love all of the different things that you guys have going on and all the different ways to heal ourselves. And Shay, do you have anything you want to close with, or?
No, I do just a little, maybe this is a little trivia question more than anything. I'm curious about what rock bands you cover in your
Yeah.
I got to hear a little bit about this because I heard a tidbit on another podcast with you, so I'm curious. You sing,
bet.
you sing,
Yeah.
you sing, right?
Yeah, speaking of creativity, I have loved singing ever since I've been a child. And before I came back to Greenville, I lived in San Diego for about 20 years. And long story short, most recently, I was really involved in the rock and heavy metal tribute scene.
Okay.
So I do some really ridiculous things. I have a spiritual teacher that says the way to enlightenment is through the ridiculous. So I guess I had to give that a try.
I love it. I love it.
I had a rock band because I've always loved Guns N' Roses growing up, and
Yep.
I did a Guns N' Roses tribute band called
Okay.
Nuns of Moses.
I
And
love it.
don't tell me how I did this, but I got all the dudes to dress as nuns, and
Oh
I
my
dressed as
God.
Moses for part of the show, and I would reinterpret some of the songs for
Oh my
Moses.
gosh.
The Hoot. And then we just did some straight ahead, kind of covers of them. And then most recently, before I came here, I was fronting an Iron Maiden tribute band, which was a lot of fun. I'd
bet.
never listened to Iron Maiden before.
I love it.
I started that band, and it's epic storytelling, and it's
Oh
great.
yeah.
And then out here in Greenville, I've actually just been called to sing stuff that's a little bit softer and sweeter. So I've done some collaborations with a local guitarist here, Matt Dingledine, and we've been covering some
Yeah.
German.
Okay.
Yeah.
Cool.
So
That's awesome.
I love singing, and I love how it feels. I mean, it's just diving into that creative
Bet.
connection. There's a deep, deep, deep connection with sound and consciousness.
Yeah.
So I also do mantra meditation, and I do mantra meditation with people, with my students, to kind of help them tap into the beauty and the power of sound.
That's great. Awesome. Good stuff.
Well, we can't thank you enough for giving us your time today. And this has just been wonderful. And hopefully we'll have you back on and possibly get you to do some more meditations and make sure people aren't driving in their car.
Right. I would have gone
Because
to
that
sleep.
was so
That was
relaxing. Yeah, we better put like a little
disclaimer, right?
warning
Yeah.
up. But all right, well, thank you so much, and I know I'll see you around with the boys.
You bet. Yeah,
So-
you bet. Thank you both very much. It's a pleasure.
Absolutely. Have a
Thank
super
you.
day. Yep. Thanks.
Bye.